body to arthritis, alcohol, maybe diet, and sometimes genetics. But now, what are the early signs or symptoms that we as the public sometimes, don't pay attention to? We'll just say that, maybe you're too new chungu kidogo to on the knee, and my elbow, my knuckles. So what are those signs that, we often overlook?
Most commonly, the pain will alert you to arthritis, because that's the beginning. That's the beginning of the disease. By the time you get swelling or deformities, of course, it's way more advanced. Yeah. So most often it will be pain. What may make people delay the diagnosis is, for example, denial in a younger person that I couldn't be having arthritis at my age. So I'd say pain is mostly it's the most common presenting thing that will make someone come to the hospital to seek care for the arthritis. Yeah.
So signs and symptoms, just the pain. Pain will take you to the hospital.
Swelling. In the case of septic arthritis, they may have things like fevers, although septic arthritis is not very common. Swelling. By the time you find someone who has a deformity of a joint, it's been something that's been going on for so long, so the pain will have brought them to hospital already. Yeah.
Let's talk to us about gender as well, because you talked about gout being more prevalent, in the men.
Yeah.
How about women? And if you talk about osteoarthritis and rheumatoid arthritis, and of course septic and lupus, which gender is more, predisposed to which type of arthritis? And we also hear about sana men, their health-seeking behavior is very, very bad.
Yeah.
So even as much as you look at this gender perspective in broader length, who are more affected from your, of course, professional work? Okay.
When it comes to osteoarthritis, it tends to be more common in the female population. Some of the things that could result in that is the fact that usually estrogen plays a role in bone strength. It's a long explanation where it helps with calcium absorption and therefore with bone strength. So you find that with age, when postmenopausal women, once the estrogen levels lower, then they're more predisposed to osteoarthritis. When it comes to rheumatoid arthritis, you also find that women are more affected than men, perhaps because it's just a hereditary condition and then presents more in females. Then when it comes to gouty arthritis, because of the factors involved, which is mainly alcohol and the red meat, which men are more likely to consume more alcohol than women are, and therefore you find that gouty arthritis is more common in men. For something like septic arthritis, we may not necessarily say men or women, because what happens by the time someone is getting an infection in the joint, it's because they have low immunity already, either due to diabetes or HIV, and therefore that may just present equally in both men and women. Yeah.
All right, and I'm looking at a certain data here, and they said recent estimates show that 595 million people living with osteoarthritis, and when we add rheumatoid arthritis to the cases, then the total could move to 600 million, and these numbers have been climbing for the past 30 years. If you're looking at in Kenya, 1 in 4 adults maybe being, predisposed or could show signs of having arthritis. Do you see this becoming a public health threat in the country? Or we are not there yet?
I don't know. I think because Kenya is generally a young population, I wouldn't say that arthritis is something that's that common. But at the same time, you find that with osteoarthritis, because of the chronic pain, joint discomfort, then you find that affects the quality of life and even the ability to function in daily activities. And so in that way, then it affects the population mostly because people are unable to just function in their normal capacity. Yeah.
Talk to us about the role of, and that question that I've asked you about this data, and you maybe if you're seeing it as a public health threat. I was trying to look at that data, so it's somewhere that by the year maybe 2050, they're saying that, you know, the number of